Cystic fibrosis (CF) is a genetic disorder. Look at these pictures, shows that healthy mucus and cystic fibrosis. Chest X-ray findings. Look at this. CT and MRI findings. Look at this. Detail going on. Introduction. Cystic fibrosis is a chronic genetic disorder that primarily affects the lungs and digestive system, though it also impacts other organs like the pancreas, liver, and intestines. It is characterized by the production of abnormally thick and sticky mucus, which can lead to severe respiratory and digestive issues. Advances in treatment have significantly improved the quality of life and life expectancy for individuals with CF, but it remains a life limiting condition. Definition: cystic fibrosis is an autosomal recessive genetic disorder caused by mutations in the CFTR, cystic fibrosis transmembrane conductance regulator gene. This gene regulates the movement of salt and water across cells, and mutations cause the mucus to become thick and sticky, leading to blockages in various organs. Types: there are different classes of CF based on the severity and type of mutations in the CFTR gene. Class 1: no CFTR protein production due to premature stop codons. Class 2: misfolding of the CFTR protein, with the most common mutation being Class 3. The CFTR protein reaches the cell surface but does not function properly. Class 4. Partially functional CFTR protein, usually resulting in milder symptoms. Class 5. Reduced synthesis of CFTR protein, leading to variable disease severity. Causes: CF is caused by mutations in the CFTR gene located on chromosome 7. It follows an autosomal recessive inheritance pattern, meaning a child must inherit two defective copies of the gene, one from each parent, to develop the disease. Carriers of one mutated gene usually do not have symptoms but can pass the gene to their offspring. Risk factors. 1. Family history. The most significant risk factor is having parents who are carriers of the CFTR gene mutation. 2. Ethnicity. CF is more common in people of Northern European descent, though it affects people of all ethnicities. 3. Genetic factors. Being born with two defective CFTR genes is the primary risk factor. Complications. 1. Respiratory complications. A. Chronic lung infections. Example with Pseudomonas Staphylococcus. B. Bronchiectasis. C. Respiratory failure. Two digestive complications. Pancreatic insufficiency leading to malnutrition and poor growth. B. Diabetes. C. Intestinal blockages. Three other complications. A. Liver disease. B. Osteoporosis. C. Infertility. Pathophysiology. The CFTR protein regulates the movement of chloride ions in the epithelial cells. In CF, mutation in the CFTR gene disrupt this process, leading to decreased chloride secretion and increased sodium absorption, causing dehydration of the mucosal surfaces. The production of thick and sticky mucus, particularly in the lungs and digestive system, chronic obstruction and infection in the airways, blocked pancreatic duct, preventing enzymes from reaching the intestines to aid digestion. The pathophysiology of cystic fibrosis involves a series of molecular and cellular events that result in the hallmark symptoms of thick mucus production, airways obstruction, and chronic infection. Below is the step-by-step process of CF pathophysiology. One, genetic mutation in CFTR gene. 2. Defective CFTR protein. 3. Disruption of chloride and sodium transport. 4. Thickened mucus accumulation. 5. Chronic inflammation and infection. 6. Progressive lung damage. 7. Pancreatic insufficiency. 8 other organ involvement: liver, intestines and reproductive system. 9 systemic effects. This progressive process results in the characteristics respiratory, digestive and systemic complications of cystic fibrosis. Signs and symptoms. The symptoms of CF vary but often include: 1. Respiratory: chronic cough, wheezing, shortness of breath, recurrent lung infections, nasal polyps and sinusitis. 2. Digestive: poor weight gain despite adequate food intake, greasy stools, defective with bowel movements and intestinal blockages. 3 others: salty tasting skin, clubbing of the fingers and toes, delayed growth and malnutrition. A diagnosis: 1. Newborn screening blood test for elevated immunoreactive types engogen levels. 2. Sweat chloride test measures the concentration of chloride in sweat with levels about 60 mmol per L, indicating CF. 3. Genetic testing: identify mutations in the CFTR gene. 4 other tests: A. Pulmonary function test to assess lung function. B. Chest X-ray or CT scan, MRI to detect lung damage. C. Stool test to evaluate pancreatic function. Nursing diagnosis: 1. Ineffective airway clearance related to thick, sticky mucus in the lungs. 2. Imbalanced nutrition, less than body requirements, related to pancreatic insufficiency and malabsorption. 3. Risk for infection related to chronic lung colonization with bacteria. 4. Activity intolerance related to decreased oxygen supplies and respiratory dysfunction. 5. Anxiety or impaired coping related to chronic illness and frequent medical interventions. Management: 1. Airway clearance techniques: percussion, postural drainage, and use of devices like the fluter to help mobilize mucus. 2. Medications: bronchodilators to open airways, mucolytics like Dornius alpha to thin mucus, inhaled antibiotics to treat chronic infections. CFTR modulations, example Eluma catheter to improve the function of the defective protein in certain mutations. 3. Nutritional support: high calories, high protein diet, pancreatic enzyme supplements, fat soluble vitamin, supplementation. 4. Exercise: regular physical activity to help the airways clearance and improve overall health. Treatment: 1. Medications: A. Antibiotic for infections, B. CFTR modulators to correct the defective protein, C. Anti-inflammatory drugs to reduce lung inflammation. To lung transplant: consider in advanced stages of CF when lung function severely declines. 3. Pancreatic enzyme replacement to aid digestion in cases of pancreatic insufficiency. 4. Oxygen therapy for individuals with severe lung disease. 5. Gene therapy. Experimental therapies are exploring ways to replace or correct the defective CFTR gene. Psychosocial medicine: CF significantly affect patients' emotional and psychological well-being due to the chronic nature of the disease. Psychosocial support may involve: 1. Counseling and therapy to help patients and families cope with the emotional challenges of living with chronic illness. 2. Support groups for CF patients and caregivers. 3. Addressing issues such as anxiety, depression, and social isolation. Prevention: CF is a genetic disorder, so it cannot be prevented. However, carrier screening is recommended for people with family history of CF or for couples considering having children to determine if they are carriers of the CFTR mutation. Early detection through newborn screening can prevent some complications and allows for early interventions. In conclusion, cystic fibrosis remains a complex, life-threatening condition, but ongoing advances in medical treatments, particularly CFTR modulators, have improved survival and quality of life. Management requires a multidisciplinary approach involving respiratory therapy, nutritional support, medication, and psychosocial care. With early diagnosis and comprehensive care, individuals with CF can lead longer and healthier lives than ever before. Thank you. Have a nice day.